Good evening, everyone. This is Steve Ward with Docked Out, your host. Thanks for joining us. You can find us on YouTube, Facebook, and Instagram. Search for Docked Out Official. You can always email me, steve@dockedout.org as well, and I'm happy to get back with you and correspond any questions or issues that you may have. Feel free to chat in questions or comments throughout the broadcast, and towards the end, I'm happy to always answer any questions that you may have. And if you would, put in the chat where you're from, any information about yourself that you'd like to share. That's always fun to have. So we're continuing a series on transgender ideology tonight. We've talked about where this ideology came from, originating in progressive thinking and postmodernism. We've talked about intersex disorders. We've talked about some of the philosophical implications of transgender ideology. But we're shifting gears a little bit tonight. And I just want to be really upfront with everybody. This is a tough topic that I'd like to discuss. I want to just very openly have a conversation together about suicide, specifically in the transgender community. And I really debated with myself, should I talk about this? How should I really approach this? But we've got to do it. And the reason is that a lot of the advocates for gender affirming care will cite statistics that make it sound like the suicide rates in the transgender community are sky high because of transgenderism, and therefore we must affirm people along this pathway. So there's literature out there that transgender activists will use in order to give you that kind of statistical information. So we have to be educated about those studies, what they say, what they conclude, or at least what they claim, and whether or not those conclusions are actually valid. So that's where we're going tonight. We've got to talk about it. I think we've got to get this out in the open because this whole question of the suicide rate is being used to usher and to push especially children through this process of gender affirming care. So we have to know how to respond. But like I said, this is a very sensitive topic. So if you have people with you or around you and you don't think it's appropriate, this is a good time to maybe get some privacy. Also, mental health disorders are very serious. If you're struggling with depression, suicidality, please get help. Please make sure that you get the help that you need. And I want to try to just encourage all of you, if you need to reach out for help, the National Suicide Prevention Hotline is 988, or find a local hotline for yourself or for a loved one, anyone that you know that might need it. Please do that and take that seriously. So what we're going to do is look at some of the claims that you'll hear in transgender activism, and then look at the data itself that we know about suicide rates. And I want to try to expose studies that are used to support gender affirming care and show you the many flaws within the methodology that is being used. And I want to also make the case that underlying mental health disorders in people that have gender dysphoria, very significant. And that's important to know. We'll also take a look at the role that social media plays in this whole discussion that's happening in our culture. So what are some of the claims? Well, transgender activists will say that we must affirm people who have gender dysphoria because of an over 40% chance of suicide unless somebody is transition. So we need to know, is that claim true? We're also told that gender affirming care will therefore save lives by preventing suicide. So is that true? Is it true that as a result of that, to withhold or to deny gender affirming care is a form of child abuse? And there's a claim out there that gender ideology will put forward that, and people that are struggling with their gender identity at very, very young ages will tend to persist in that gender identity. Uh, However, we need to know what are the rates of desistance, as we call it, the number of people who will actually move beyond their gender dysphoria if we don't do any type of gender affirming care. So what are those rates? We'll also hear by a lot of proponents that we have to start a transition process earlier, younger, and faster in order to prevent long-term harm. And then we'll also hear the claim that if you don't affirm somebody through the process, then what you're really doing is shaming them or causing fear and harm to them. And we're messaging that there's something wrong with who they truly are in this alternative gender identity. So let me just pause there for a minute. So, what is the general response of the church? Like, what's our obligation here? Well, I think first of all, it's very, very important to never shame anyone, right? We have to meet people where they're at, regardless of where that is. And if somebody is struggling with gender dysphoria, we have to take that seriously and love them, build a relationship with them, try to help them along the process. Love them, be their friend, minister to them. But remember that to love someone will require that we tell them the truth. And that doesn't mean, it's not the same thing as affirming them along this process. So in order to really love someone, we have to know the truth. So we need to be informed about some of this research. You don't need to be an expert or an epidemiologist or any of those things. But I think we have to have a working knowledge about the statistics and what's being told to us through the media in the culture and understand whether or not those claims are true. I want to make the case tonight that many of the claims you're hearing are not true, or at least they're a distortion or a misrepresentation in a lot of different ways. So, what are the actual rates of suicide attempts in a variety of different mental health disorders? Let's just kind of start there for a baseline. So, someone with autism has an 8-time higher likelihood of a suicide attempt. An LGB individual, lesbian, gay, or bisexual individual, it's actually 20 times the normal rate of suicide attempt in the general population. Someone with depression, it's also similar, about 20 times the baseline rate. An individual with anorexia or bulimia has anywhere between an 18 and 30%, or 18 and 30 times rather, higher rate of suicide attempt. And that's just absolutely tragic. And it speaks to the mental health crisis that we have in our culture and people that we really need to help who are suffering greatly. But what's interesting is that in the transgender population, that rate is 13%. So lower than the 20% or 30% or 18%. So 13% seems to be the best information that we have kind of across the board. So keep that in mind and just the background of your mind that underlying mental health disorders increase the rate of suicide attempts significantly. But transgenderism actually comes in underneath a lot of other diagnoses. Now, the fact that so many people are suffering through this should really give us pause, especially as Christians, help us to just understand the compassion and sensitivity of this type of topic, okay? So keep that in mind as well. So, what's some of the other literature? So, in terms of underlying mental health issues, so the Tavistock Clinic in the UK, it's a transgender clinic, mental health clinic that has dealt with this over the years. They published a study in the British Medical 2012, there are three other similar. What they demonstrated was that about two-thirds of the kids that are presenting to them in the gender clinic had very significant, severe underlying mental health diagnoses and or autism spectrum disorders. And that's before they developed gender dysphoria. Okay, so that's in the background. And also, what's interesting is that about 75% of all of those patients coming into the clinic were girls. So there's this kind of skewed population according to gender where girls are more prone to this. So those are interesting thoughts that we have to keep in mind and ask ourselves, well, why is that? What are some of the other contributing factors that might be involved? Now, here's something I really want you to hear and let this sink in for a minute. But in these four studies and others, what we learned was that if you treat the underlying mental health disorder, the gender dysphoria actually, okay, so that's profound. And I think that speaks to the fact that gender dysphoria is actually a symptom of underlying mental health disorders. It's not the cause of future mental health disorders that might lead you specifically because of that towards a suicide attempt. There's a lot going on with the individual underlying all of that that's really, really important to know. And there's a study I'll get to a little bit later on that says if you follow people out after a puberty blocker, hormone therapy, or surgical transition, if you follow them out over time to about the 10-year mark, you'll actually see that their suicide attempt, the rate, is about 19 times the general population. So to me, what that means is the actual transition itself didn't work. It wasn't effective, right? There might be some initial relief of treating the dysphoria itself as a symptom of this individual's distress, but over time, the treatment in gender affirming care is actually harmful and not effective. Okay, so those are really, really important concepts to try to keep in mind. So let's take a look at a couple of the studies that are used to further propagate some ideology. So these are based on surveys, and that alone is problematic because you can't demonstrate causality just from a survey where somebody is asking questions and answering a questionnaire. But there was a survey called the Rare Research Project published in the UK, 2015. This was a survey. It was non-random, very small number of people that were studied. And it had some biases, potential conflict of interest, because the people who funded this study were members of an LGBT charity organization. But they surveyed over 2,000 people, about 2,100 individuals. And what they found was only 27 of the people who responded said that they were transgender. Those who were less than 26 years old. Okay, so the younger people, only 27 of them. And then 13 of those 27 reported a suicide attempt at some point. Okay, that's a key phrase, at some point. So in this study, what the authors did said, well, 13 out of 27 people, that's about 48%. They say 48% of all transgender youth attempt suicide. That is not what the study says. You can't conclude that. Okay, so that's not true, but that's the claim that is being put forward. So, and the reason that this is not valid is because, remember, the underlying mental health issues that this survey did not address. All it asked the patient was, did you have a suicide attempt at some point? It didn't clarify if that attempt was prior to their gender dysphoria and transition, or during or after. So there are no further details. So you can't claim that 48% of transgender youth will attempt suicide. That's just, you just can't do that based on this particular study. So that's super, super important to understand. There's a second study that's worth mentioning. It's called the School Report. And this came out in the UK as well in 2017, published by the University of Cambridge, a very similar survey, but it reported that up to 84% of the people they surveyed had done some type of self-harm, like cutting or some other type of harmful behavior. Over 90% had a suicide ideation or an idea or a plan, and about 45% attempted suicide. But again, the underlying mental health disorders and the timing were not identified and not discussed. So this is also not a valid study. You can't make the claim that 45% of transgender youth are going to attempt suicide. That's just not a valid conclusion based on the methodology that was actually done. So these results are grossly misrepresented in the media and by transgender activists. So they might say something like, and imagine saying this if you're a psychologist or a physician in a gender clinic, a parent comes in with a child that has gender dysphoria. The parent is distressed, doesn't know what to do, is trying to help. They're coming to who they feel is a professional to try to get help, right? But what a lot of these professionals will say is that, hey, the suicide rates are over 40%. Do you want a dead daughter or do you want a live son? You know, they'll make some type of really pretty outrageous claim based on faulty data. And that pressures people down this pathway of gender affirming care, which is experimental and potentially quite harmful based on false information about rates of suicide attempts. So to claim that your child is going to attempt suicide unless you go through this pathway is simply, I believe, intimidation, and it's just plain activism that's based on ideology. It's not based on science. A lot of the studies we'll get to focuses on treating the symptom of gender dysphoria, helping people to feel better and to alleviate the gender dysphoria, but the underlying mental health issues are not addressed. So what do we really make of this? Like, where are we going? Well, I want to try to make the point that gender dysphoria is similar to other conditions such as, anorexia, bulimia. There's an entity called body integrity identity disorder, which is more rare, but it's still really interesting and fascinating to think about. But basically, in anorexia, for example, there's this phenomenon of peer groups online, on social media, just in the culture, that will encourage young people to go through, extreme diets, trying to lose more weight in order to become more accepted. Like if you're a serious anorexic, a really truly authentic anorexic, you will just continue down this path of losing weight to the point of illness and significant life-threatening complications. And people who want to stop and get help for themselves can be ridiculed. This is very similar to what's going on in the transgender community on social media platforms. But remember, we don't treat an anorexic patient by doing liposuction, by doing all kinds of surgical procedures to try to make them more slender, right? We don't do that because we know the harm. Well, similarly, we don't want to usher someone down, especially a child, down through puberty blockers and hormones and surgery for experimental treatments with no benefit, with demonstrated harm based on faulty data, right? We just wouldn't do that. That's not ethical. So there are some similarities there in how the culture handles these things. In body integrity identity disorder, so this is somebody who has a normal body. Physically, they're totally normal, but they believe that they have a disability. And that distress, that dysphoria, so to speak, is so severe that they'll actually seek surgical attention to have an amputation performed on them. Or they might believe themselves to be paralyzed, so they'll actually seek out a neurosurgeon to sever their spinal cord for them in order to accomplish the paralysis that they believe that they have. So these are really They're rare, okay, but fascinating illustrations that what's happening with the body is different and distinct than what is happening in the mind. And we have to align the two. But in order to do that, we don't want to surgically alter or give chemicals, give drugs to people that alter the body when in fact the problem is more in the mind. So hopefully that makes a little bit of sense. So, what are some of the causes of the underlying psychiatric illnesses that we see in the transgender population? So let's just shift gears a little bit. So, what's going on with people who develop gender dysphoria? Why does that happen? So the short answer is that it's very complex, but we do know quite a bit about trauma. And I'd like to talk about what we call adverse life events. These play a huge role in a lot of underlying mental health issues. So, for children who are born into troubled homes, they're going to have a lot of complications. And I think that just makes sense to all of our life experience. But people that have had these traumatic adverse life events will actually experience their psychiatric issues, and they'll experience their traumatic event much more severely than somebody that does not have the same degree of an underlying mental health problem. So there's this type of like a feedback mechanism. So about 2/3 of all people, it's very common, have had some type of adverse life event or life trauma. But in people that have come forward and been transparent about their life history, 100% of transgender identified individuals have had a traumatic adverse life event in their life. And what I want to try to help you see is that trauma affects brain development. It's not just how you feel and you feel traumatized, but there are physical, very real changes that happen in brain development as a result of the trauma. So the chronic stress, let's say you live in a home with violence and you're under threat of being abused in any type of variety of different ways. So your cortisol level, your stress hormone level is high chronically. It's like you're in fight or flight type of a mode. Well, that's going to have a lot of deleterious long-term effects. Increased blood sugar, increased heart rate, chronic inflammation, which then causes increased atherosclerosis, increased risks of cardiovascular disease, increased risks of chronic pain syndromes, anxiety, and depression. And what we see also is that the volume of the brain matter, the substance of your brain itself is actually deranged and smaller in the limbic system, the amygdala, the hippocampus, the frontal cortex, a variety of different locations. And what that really does is it increases your risk of having problems with your memory, decreases attention, can decrease IQ, impairs your ability to have executive function, as we say. So that's your ability to evaluate choices and make good decisions. So you have increased high risk behavior. You have alcohol and drug use, which is higher. So smoking, that has its own chain of effects. So risks of COPD, stroke, heart attack, diabetes, obesity, the list is long of complications. But what I want you to understand is just the concept that trauma and abuse in the home at young ages, when you're in a developmental stage, bullying as well, will physically alter your brain in such a way that your brain development is impaired and you're at risk for long-term, very significant mental health complications. And we'll see that a subset of those type of individuals will develop gender dysphoria. So again, it's the underlying mental health issues that is often causing the gender dysphoria, not the other way around. So some of those stressors might be, violence in the home, abuse, rape, attempted rape, death of a parent, divorce, moving, separation from friends, substance use in the home. And, honestly, I hate to say it, We have an epidemic of fatherlessness, divorce. I mean, this stuff is real. It's everywhere. There's a reason that we see gender dysphoria on the rise for legitimate underlying psychiatric reasons, in addition to the cultural and social media pressures that are on our youth. So we have the perfect storm going on here that's really putting a lot of people at risk. We need to know what we're dealing with in order to treat it properly. All right, so let's shift gears again. So, what are some of the studies that talk about discrimination of transgender individuals and how that discrimination might lead to higher rates of suicidality? Well, again, these studies are often misused, to be honest, and misinterpreted with poor methodology and invalid conclusions, yet they're propagated shamelessly in society. And we need to call that out and get everybody educated so they can filter what they're hearing in the popular culture. Okay, so in 2011, there was a paper that came out. It was called Injustice at Every Turn, a report of the National Transgender Discrimination Survey. I have a copy of all of these. I read them. Okay, I studied them. What I'm trying to do is do this research for you, digest it, present it in a way that hopefully is helpful to you. So I have copies of all of this. Okay, I'm not making any of this up, and this is not you know my opinion. This is what these studies say. Okay, so the language that was used, I think, is very inflammatory. So this was more a paper of political motivation and ideology with very charged language. And let me give you some examples. So the goal of the study is very openly, and this is written in the paper itself, quote, to influence activists to struggle for equality and to counter right-wing lies. Okay, so they're assuming that the opposing viewpoints are lies, for one. They're shutting down debate and open scientific discussion. And notice that the goal, what's not on the list of their goals, is to discover the truth. So notice that. Sometimes notice what you're hearing, but also notice what you're not hearing. Okay, so this is a ideological paper. Side note, a lot of the progressive community will say, talk a lot about tolerance. Remember that tolerance, just by definition, tolerance means that you are tolerating the other view, right? So tolerance as a concept presumes the existence of opposing views. Otherwise, you wouldn't need to tolerate anybody, right? So if you're shutting down another viewpoint, not allowing debate or name calling and just saying, well, the opposite view, those are just lies, it's really disingenuous. You're not tolerant at all. So to say you're tolerant, what they're really trying to say is, they're tolerant of people who think like themselves, which is really not tolerance. So just keep that in the back of your mind. But the language in this paper was very inflammatory. So it'll say things like there's rampant injustice in homes, in schools, in workplaces, appalling realities discovered in this paper, they say, structural racism. And they say that the real moral failure is society's unwillingness to embrace all these different gender identities. Okay, so that's all ideology. That's not science. And let me get to a little bit of the survey itself. So again, this is a survey, so it's not going to be able to show you ideology really, it's not going to be able to prove causality. These are just associations that they are able to, pull out. But you can't say one thing causes the other. There's just not enough type of high quality statistical information in a questionnaire. But they surveyed about 6,500 individuals who said they were transgender or gender nonconforming. And what they claim is that 41% of those individuals had a suicide attempt. Unemployment rates are double. Unemployment rates for people of color was actually 4 times. 90% of the individuals surveyed claimed to have on-the-job harassment. Many were fired or denied promotions. About half of the people who were surveyed said that the rates of home ownership were lower. Uh, a quarter of the individuals said that they were denied rent, denied a lease because they're transgender. Harassment by police or the court system. 20% were refused medical care or postponed medical care out of fear that they were going to be discriminated against, etc. So these are just claims, but again, is this really valid information? Is this really, a slam dunk? Can we take this information to the bank and say, yeah, this is real, and based on this, we need to support youth going through transgender care so aggressively? Can we do that? Should we do that based on this information? And my answer is absolutely not. So there are very significant limitations here. Specifically, I mentioned the causality problem, where you can't conclude that discrimination or violence was due to the transgenderism itself. And we know that people that have underlying mental health disorders are at risk for some of those things. So again, could some of the discrimination or the perceived discrimination been due to the underlying mental health problems rather than the transgenderism itself? That was not explored or discussed in this particular study. We know too that people with mental health disorders can have an increased perception of stigma against them that isn't truly present, but there's this increased perception of stigma. Now let me just, back off for a second. And I want to acknowledge that bullying is real, stigma is real, discrimination is real. So I'm not denying that a transgender person goes through these things. I'm just saying that in this particular study, you can't demonstrate and conclude the direct relationship and use that information to make policy. Okay. Another limitation was that this survey is self-reported information. And we know also that people who are bullied or have violence in their life or have lost a job will have higher rates of suicide attempts. And that's in all people across the board, regardless of whether or not they are trans. So again, there's major issues here with the study. And notably, they only asked one specific question. So the questionnaire, it was like one question: have you ever attempted suicide? And that's it. There was no follow-up to that. So it doesn't address the underlying mental health problems, the timing of when that attempt might have been. Was it before they developed gender dysphoria? Was it after a transition? What was going on there? We have no idea. Yet activists will say just flat out that we have sky-high rates of suicide attempt. That is not accurate to make that conclusion. Now, what's interesting is that when the flawed methodology was subsequently corrected, this data cut the rate of suicide attempt in half, from over 40% down to about 20%, which actually, it's still awful, but it falls more in line with what we see in the LGBT community, people with depression, people with anorexia, bulimia, for example. So falling in line with the rates that we would normally expect to see in people who had those kinds of underlying mental health problems. So this does not whatsoever demonstrate that the transgenderism itself has anything to do with the higher rates of a suicide attempt. So what are some of the other problems here? So we know that people who have underlying mental health problems might not complete their education. They might not hold a job. There's higher rates of disability and poverty. Those things increase rates of suicidality. It's not discrimination against them doing that. It's the mental health issue itself and the complications of that causing the distress and the suicide attempts. So again, we need to treat the underlying mental health. There's also one claim or conclusion that the authors tried to make, and this really caught me a little bit off guard, but it's important. So I want to throw this out here. So if a transgender person believes that others can tell that they're transgender, those people will have higher rates of suicide attempts. Okay, so I just want to reflect on that for a minute, because really what that means is that the individual's belief system is such that they're getting their affirmation of who they are, of their identity, from other people, not from within themselves and not from God, right? Because their distress, or their increased distress and increased rate of suicide attempt, is based on not what's going on specifically within themselves necessarily. It's what they believe about other people's perception. So there's this idea that uh, part of the problem is an identity crisis, where we're looking for the approval and affirmation in other people in order to feel good about ourselves, rather than understanding that God created us in his image, loves us, and so forth. And I think that's really tragic, and it speaks volumes to me about the spiritual nature, the spiritual underpinning of this ideology. It's a result of atheism that has spread through society. It's a result of the very hyper secular society that we have, where we deny the existence of God. We think we have evolved from pond sludge, and there's no right or wrong, there's no morality, and so forth, and all of those other issues that follow evolutionary theory and naturalism. There are tragic consequences to that, and we're seeing those consequences in our culture now played out within transgender ideology. One other point I wanted to make, so women in this study who underwent and completed surgical transition actually did worse. Later, afterwards, they had higher rates of suicide attempt. Again, showing that the process of transition is not effective and is actually harmful, at least for some people. I think we could really further injure somebody that is prone to being injured. People who have an underlying mental health issue, who are vulnerable. I think we make that worse by telling somebody that you're not okay who God created you to be, the sex that you were born as. You're only going to be happy if you transition into somebody else. That's really what we're saying, right? I mean, that's an awful message to give somebody. So I think we can actually make people's underlying problems much worse, and that could be part of what's going on. There's also a very powerful and very real power of suggestion, where we tell a transgender youth and their parents that, hey, we expect your child to 40% or more are going to try to commit suicide. I mean, so there is this type of self-fulfilling prophecy or effect, where we actually train people to believe that about themselves, which can lead people to actually try to do it, which is another awful message, but that's what's going on as part of this ideology. So that's a little bit of an overview of that. So there are some good conclusions, though, as well. Got to be fair. So it teases out that the underlying mental health issues do, in fact, predispose people to suicide attempt. Already knew that, though. It also teases out that bullying makes the suicide attempt rates worse. And that's to be expected. So we would already think that. So really the message here, so what do we do? Always, we have to stop bullying. Bullying is always, always wrong. It's always harmful. Remember, though, that we don't want bullying, but that doesn't mean we're to affirm either, right? Those aren't the same thing. Another key message is simply to get help from a mental health professional that you can trust to help you with your underlying mental health problems. And because a lot of the adverse life events or the trauma that young people experience is it's within the home, within the family, right? Maybe the family is broken, maybe there's violence and substance abuse, marital strife, and all those things. So this really, to me, says you have to um, work on your marriage and work on yourself if you're a parent, right? Or you're a family member that's involved, because there is this ripple effect to the people around you that can be truly devastating. So, why don't we do that? Why don't we have this awesome and robust access to psychological support? So, what are some of those obstacles? Well, in 2013, the American Psychiatric Association changed some terminology. They changed the language to that they use to define people with gender-related distress. They're calling it gender dysphoria now, um, in order to remove stigma that a person might feel if they were told they had a mental health disorder. I think that's really was the wrong decision to soften the language in order to mask the truth from people. Um, but hey, that's the situation. And there are 3 countries so far that have taken very aggressive legal action against people who would counsel a transgender young person or even adult to try to help them with this. So in New Zealand, it's illegal to do talk therapy. That's also called conversion therapy, where you're trying to, it's not talking about spiritual conversion or salvation. It's talking about trying to counsel somebody and improve their thought patterns to treat the gender dysphoria to help that go away. So that's actually illegal in New Zealand. It's also illegal in Israel, where you can have your license pulled. And in Canada, it's also illegal. You can lose your license and actually be arrested and imprisoned. And there's also a very aggressive movement within Canada, and unfortunately, probably will eventually come here too, where there's an effort to silence the church and to stop the church from speaking out about biblical patterns of sexuality. So these things are being, these laws are being weaponized specifically against people of Christian faith, which I think also speaks volumes that this is this is a spiritual issue at its core. It's a it's spiritual deception. There's no other way to put it. There was an article in Time magazine where the author, who was a transgender activist, made a couple of statements that are worth just being aware of, just to show you the power of the anti-Christian sentiment that's going on here. So in this article, it says conversion therapy is unconscionable, should be called child abuse, should be illegal in all states. Those who break the law should be locked up. And then the author goes on to say, I'm not objecting to all religious beliefs so long as one can separate those beliefs from actual medicine, talking about gender affirming care. And then it goes on to say, the point at which a religious belief means abusing American citizens is the point at which religious freedom ends. Okay, so just, I mean, think about that for a minute. Let that sink in. So this is the real end goal here, is there is a destruction, there's an effort to destroy religious freedom and to take away the ability to speak an opposing view, to speak truth into the lives and hearts of people who are struggling with some of these things. Here's more. In 2016, JAMA, the Journal of the American Medical Association Pediatrics, published an article. It's called "Mental Health Disparities Among Transgender Youth: Rethinking the Role of Professionals." I read this. I was like, okay. So the authors said that to establish a therapeutic relationship with a patient requires honesty and a sense of safety. But then it goes, which is true, but then goes on to say that that safety can be compromised if young people believe that what they need, which is hormone therapy, surgery, blockers, can be denied them. So in other words, it's now the role of the professional to listen to the patient, tell them what they want and what they think they need. And then that mental health or medical professional is obligated to provide that gender affirming care. So we're basically just following feelings, which is progressivism. And that's what makes it ideology. It's not based on science. There's further redefinition going on where the bioethical objections, remember last live stream we talked about the concept of do no harm. That's non-maleficence. So but the language has been reversed where the objection is basically that doctors are paternalistic by explaining to your patient why a certain treatment is good or bad for them. That's considered paternalistic. The doctor should no longer be able to discuss what they feel is harmful to the patient or not. That's paternalism. Okay, again, that's ideology. That has nothing to do with whether or not we're following the true research. The word binary is now seen as the ideology. So there's role reversal here, where if we say we believe in the binary genders, we're accused of ideology. And this transgender community will put forth the idea that gender fluidity is actually fact, like it's a slam dunk conclusion, which of course it is not. And then I think what is really damaging to the potential to counsel people appropriately for their underlying mental health issue is the fact that mental health assessments that should be done by a mental health professional are now considered traumatizing to the patient and are frowned upon, which to me is just, I mean, where do you go with that? So, that's where we are. So I'm just trying to help you understand where we are. Reminds me though of Isaiah 5:20. Woe unto them that call evil good and good evil, that put darkness for light and light for darkness, that put bitter for sweet and sweet for bitter. So, we need to respond with compassion for the individuals who are struggling through gender dysphoria and their other mental health issues. But let's also remember that, the church needs to hear this. And I say this with a little bit of caution, but I think I need to say it. We need to have a loving approach, including some of the medical doctors, surgeons, endocrinologists, pediatricians that are pushing this. This is a matter of spiritual deception. It's based on ideology that is grounded in atheism. Let's have compassion on them as well and meet them where they're at. They're people who are sincere, who believe that they are doing the right thing, who have the best interest of their patients in mind. So let's remember that without the spiritual foundation that we can only have through the Word of God and the Christian worldview, salvation, the gospel message, being indwelt by the Holy Spirit to become a new creature, that's our hope, right? So we know that. So it's no surprise that a secular society would be involved in those things. So I think we need to take the temperature down. So a lot of times Christians would say, well, that's the far left. Those are the radicals. It's all crazy. It's mental illness. So we got to take the temperature down. Take the temperature down. Respond with love and compassion, remembering that a lot of the people who have gender dysphoria have it because of traumatic life events that have caused them mental health problems. Okay, gender dysphoria is often a symptom. So let that help us have compassion and reach out to them in the right way, get them emotional help, get them spiritual help. That's the role of the church. There was a suicide note that was left by a teenager who I think I need to read it at least a small portion of it. Okay. So in this note, the teenage girl told her mom about or explained that her mom, who was a Christian, reacted extremely negatively, that I would never be truly a girl, that God doesn't make mistakes. And then subsequently, this Christian mom took her to a Christian therapist who reinforced the idea that being transgender is wrong. Okay, so how we address these issues is so important because if we cause shame, you'll never hear from people again. They're out of your family, they're out of church. Our job is to be salt and light. So be salt and light. Be loving, have compassion, tell people the truth, to just say you're wrong, and to use these types of spiritually sounding phrases like God doesn't make mistakes. I mean, that's true. Of course, God doesn't make mistakes, but that's not going to help the person by creating a negative atmosphere that's shaming of them. Because remember, what they're really needing is treatment for their underlying mental health problem. So that's the focus: psychological help, spiritual help. All right. So, why? I mean, why are teenage girls in particular at higher risk for depression? Let's talk about that a little bit. It's an important question I wanted to make sure I throw out there for you. So, teen girls have a 3 times the rate of suicide attempt, oh, sorry, of depression compared to boys. About 1/3 of girls are affected. Okay. So, there are some reasons for this, and it has to do with the nature of girls. So, girls, and this is a stereotype. It's, this is across the board, broad brush statement. Okay. So, in general, girls will tend to what we call ruminate, or think more, be more thoughtful of the problems and stresses that they're going through. And they also co ruminate about those things with their friends. So, girls tend to be more socially oriented, which is a great thing. But the risk is that by sharing your problems and, uh, I don't want to say overreacting, but fixating maybe, or just having a pattern where you're just regurgitating those things continuously with a peer group can cause this kind of phenomenon where the anxiety and depression spreads and becomes higher prevalence. Girls may have lower self-esteem issues. Some of that has to do with body image, um, perceptions as they go through puberty. Girls tend to be more sensitive to emotional distress, which is that's also a good thing because girls are God designed in their nature and physically in their psychology, in their the physical structural makeup of their brains as well, for child rearing and emotional compassion of children. So yes, girls are more emotionally sensitive, but we want that. That's a good thing. But be aware that there are some risks that are associated with that. Girls tend to emphasize their relationships more in their peer group. So if there's a falling out with friends and all of that, that can increase anxiety and depression rates more severely. And then girls who spill everything on social media can then be exposed to more bullying online and things like that. So, that is a real phenomenon. Um, so, what about smartphone use? So, this has been in the news recently. There are some new studies coming out here soon. But historically, what we know is that starting at around 2011, we see a huge uptake, a spike in rates of depression in young people. But that's also the year that social media became much, much more heavily prevalent, used in the culture. So there's a correlation there between the rapid growth of social media use and depression starting at that time period, but it's just a correlation. It's not a cause and effect proof at this point. There's ongoing studies, so it's very complicated. For example, we don't know, is it because depression is worse and therefore people are isolating and they're on social media more? Or is the problem that they're on social media, which makes them more depressed? So that's the problem that we have to try to unravel. So we don't know exactly, but just be aware that starting at around 2011, 2012, we see this increase in the rates of depression in young people. That seems to correlate. All right. So having said that, so what is, motivating young people to undergo a transition if they have gender dysphoria? Okay. So a lot of it has to do with compliments on social media. So you can actually have higher social status, so to speak, in your friend group if you are transgender. Some increased popularity, perhaps more online followers. So there's a lot going on socially within the adolescent community that involves peers and social media and the cultural messaging that they're getting. So what do parents actually say? So what parents say of transgender kids is that it sounds like their kids are like reading from a script, being told what to say. And their social media use was sky high, parents noticed, right before they claimed to be transgender. And also, all of their friends at school or elsewhere are also coming out with their transgender status, this changed their gender identity all at the same time. So, about 90% of the transgender youth were heavily involved in social media and in a peer group that was all going through this together. And on some occasions, the kids were actually like rewriting their diaries and journals, altering entries, basically so it appears more that they were having this dysphoria, this identity crisis starting at a young age, and have always had this. So there's just a lot going on. So what's the role of social media? So I found this to be, truly flat out scary. Okay. So there are sites on YouTube, TikTok, Reddit, Tumblr that will actually post and educate adolescents on how to get what you want. So what they'll do is, and here are some statements. So they're basically being coached by these social media personalities on what to say in order to get hormones and affirmation. So here's what they teach, and this is actually on the post. I'm going to read it to you. Find out what they want to hear. I'm talking about parents or doctors, and then just tell them that. Okay, get a story ready in your head. Keep it limited to stuff that can be verified. Look up the diagnostic criteria and make sure your story fits. Okay, and then there's messaging on social media about this myth of urgency that if you don't transition early and soon, that you're gonna be miserable for the rest of your life. Okay, and what's particularly concerning to my mind was just how vague some of the symptoms of gender dysphoria really are. If you go to a gender clinic and you say you have some of these things, you'll be told that you have gender dysphoria, and kids are being coached on what to say. And here it is. Difficulty with getting through the day, a sense of misalignment or disconnect or estrangement from your own emotions, seeming pointlessness to your life, no sense of any real meaning or ultimate purpose, knowing you're somehow different. Notice none of those things have to do with gender. They're just very broad, vague, non-specific symptoms that honestly, like, we all have at some point, right? When you're young and going through puberty and all that upheaval in your life. And so anybody could be told they have gender dysphoria. But this is the coaching that kids are getting on social media. They're being told that transition's the only option, that anybody with an opposing view is transphobic, that cisgendered people are discriminating against you, a putting down of the nuclear family, kind of you're now a member of the oppressed victim group, and welcome, social justice, be a social justice warrior for equality, all of this kind of stuff. um, Kids are also told, how do you order hormones online? How do you get money from people who will support you in that? How do you hide medications and binders and different things in the home? um, you got to get your kids off of social media. Okay, so if there's one treatment, it's not surgery or puberty blockers. It's take your kid's phone away, okay, or put some parental controls on it. I'm serious. Um, so should we just affirm? Okay, in 2015, the American Academy of Pediatrics um, put out a claim that kids who transition, social transition, do not have any increased rates of depression. So their depression will actually come down and get better. So this was actually a survey where they claimed that after transition, the rates of depression are the same as the general population. But the problem is that, just like some of the similar studies we looked at, this is looking at the mental health disorders after the transition, not comparing it to what was going on before. Okay, they also used siblings within the same family as a control group, which is really not a control group, because you can't get a fair comparison with another child that was raised in the same home that might have similar issues. So a lot of problems here going on. So again, that is not valid to conclude such things. All right, so let me try to wrap it up. So what do we really get out of all of this? So Johns Hopkins started gender affirming care, surgical transitions in the 60s. They followed patients out for a long time. And in the 70s, they put out a study that basically said and agreed with what we now know, that the transition itself did not improve the mental health of people who have gone through it. So they actually stopped performing those types of surgeries, which is a good thing. But to the best of my knowledge, that's been on and off over the years. I'm not clear what the current status is right now, but certainly this has been on an uptick. There was a study in Sweden that was published in 2011 that followed patients out over 30 years. And this is really profound. So after sex reassignment surgery, what this study noticed was that there was an initial improvement in the symptom of gender dysphoria. So you feel a little bit better. So you've treated your symptom, but over time you have higher rates of inpatient psychiatric hospitalizations. Mortality rates are actually 3 times the baseline, and survival rates go down precipitously and continue to decline over this 30-year period. And the suicide attempt rate at about 10 years after the surgery is 19 times the rate of the general population. So this is strong evidence that gender transition is ineffective, it's dangerous, it's unsafe, it's experimental, and should not be done. To the point that in 2022, Sweden, Finland, and the UK have severely restricted it, banned it for children. And earlier this year, 2023, Norway did the same, which is a good thing. We are lagging behind. We're not there yet to the point of, I think, making a strong case against gender affirming care using the research. We need to get the actual research out into the mainstream and teach and educate that the research is poor, flawed, the methodology is incorrect, and the results are invalid. So that's what I had for you tonight. I know that's a lot. I know it's a tough topic, but I appreciate you hanging with me. Let's go to some questions in the chat. Let's pull those up. We have a question and a comment. Servant Slayer, I always wonder how someone needs to speak to a person with suicidal tendencies. Any advice, doc? I think the best thing that you can do is love them and to build a relationship and their value to you. Um, it, and, without the ground that a professional would have, you're careful. You don't want to dive into question about, asking them about life traumas and things like that. So, you don't want to make um, feel worse or kind of go in that direction. So I would say the best way to talk to them is just love them and make sure that they know that you love them, that you value them, you want them in your life, that they have meaning and purpose to you, and that you're going to be there for them no matter what. Make yourself available. I think that's honestly really the best thing that you can do. And comment, wow, we are doomed. How professionals can believe in that. I know. Um, I know. It's tough. It's tough out there. What I would say is that we need Christians in all fields of science, medicine, research, everywhere. And that's the body of Christ. That's what the body of Christ is to be. And I think too often we have told young people that to be in the ministry means you have to be a pastor or a missionary or an evangelist or be in full-time employment at the church or teach at the Christian school or, whatever. All those things are awesome and we should encourage those things. But the body of Christ is it's broad, has variety, all the different parts, right, of the body. We need Christians to stand up and to take courage and to speak the truth. Who else will, honestly? I mean, who else is going to do that? So we need to get the spiritual messaging across. We need to share the gospel. We need to speak of the love of Christ, the atonement need that we have for the atonement, the reality of sin, the reality of our broken, sinful, fallen nature, and where that leads us. People need to know. And I think people want to know. They want to hear the truth. I think there's a growing movement of satisfaction with the secular culture. People know that society is, slipping, sliding as a result of what's happening in a variety of different ways. So I think people are hungry for the truth. So I challenge is to speak the truth and to speak the truth in love, with compassion, never with shame, remembering your own fallen self and your own need for salvation. And if you're a Christian, you have that and can be thankful for it and share it with other people. Be salt and light. That's really what we should be doing anyway. The transgender issue is one issue. I mean, there's a lot more, going on that we could talk about. But I think just remember that the transgender issue is really a symptom. It's not a problem. The government is a symptom. It's not the problem. The public school, the secularization in schools, in the media, in culture, in Hollywood, those aren't the direct problems. Those are symptoms of a society that has track on God. And these results are actually expected. So what do? We found new. And we have to have courage and take a stand for what is right, because it helps. I want to do. Hopefully that helps a little bit. Feel free to drop me an email anytime. I'll get back to you. Good to be with you tonight. And we'll see you next time. Take care. Have a good rest of the night.